both secure, sustainable, and aligned with EU priorities. Here we have deep experience in government engagement, data governance, cybersecurity, AI, public-private collaboration, healthcare preparedness. We are here with two great speakers who works every day on this digital transformation of the healthcare system, and they are shaping the ground in this way. I'm delighted to be joined by these two top executive voices that represent different but complementary industries, pharmaceutical and technological one. So let me introduce our speakers. First of all, Clara Lemaire. Clara Lemaire is European Government Affairs Director at Cisco, and she works across European countries, securing connectivity, digital resilience, and trust infrastructure. All of them crucial in order to have a data-driven healthcare. Well, Clara leads European government affairs work of Cisco in different industries in key sectors like financial services, health, defense, public administration, and which is more before technology, regulation and policy in technology. You've been working in different areas related to government affairs at the European level, like climate, energy, and transportation, and that brings to the table a global perspective on European priorities. Well, introduction, Pilar Pasaron. Pilar Pasaron is head of International Affairs at AstraZeneca and director of AstraZeneca Foundation. Pilar specializes in preparedness, patient-centered innovation, and also in public and private partnerships, which is necessary to have a sustainable system and a sustainable health industry. Pilar has developed her professional career not only in the private sector but also in the public one. He has worked for the Ministry of Health at a national level and also at a European level. You've been part of the cabinet of the European Commissioner for Health, also, which also brings a great, vision for this dialogue. Because now what we are going to talk about is how these two companies are leading this transformation from different perspectives. So let's jump into the conversation. Clara, I will start with you. And well, I would like to know from Cisco perspectives, what are the key opportunities, benefits, and challenges that this digital transformation in health is carrying for us?
Thank you, Pilar. And thank you very much for inviting me to speak today. It's really a wonderful event. Congratulations to the organizers. Yes, so I work for Cisco, and at Cisco we are involved in a number of digital health projects across Europe and actually across the world. And we see, I guess, two key benefits for healthcare. The first benefit is really for healthcare organizations themselves, to make them more efficient, more innovative. We know that healthcare systems are under pressure from various trends, and digitalization has helped to reduce administrative burdens, to optimize workflows. We have, for example, been involved in a really interesting project for a hospital in Zurich, which is really using AI to auto-generate discharge letters for patients. And that has really helped to save time for doctors very concretely. And here we'll go back to AI, but the ultimate vision was to establish an AI as a service for Swiss hospitals in general. So I guess that's one area, like more efficiency for healthcare organizations. The second area is more, on actually better care for patients. And we are involved in a lot of telehealth projects, and we are also, involved in projects that are, again, AI-driven for early detection of some diseases. One thing, actually, this morning I realized we had, during COVID-19, quite an important project in Spain using federated learning, which we talked about earlier, with other partners like Vodafone Spain, Intel, using AI to improve the accuracy of COVID-19 diagnosis and predict case severity. So that was using an AI model that was trained by a large number of chest X-rays conducted in several hospitals across Spain. So that allowed better detection and better care then for patients. Then in terms of challenges, cybersecurity is a big concern for us at Cisco. Unfortunately, the healthcare sector is one of the most targeted critical infrastructure sectors in Europe. Healthcare data is very attractive for cyber attackers. We know that medical records are worth 50 times more than credit card numbers on the dark web. So that makes it very attractive for attackers, unfortunately. And so this is something that is critical to the sector, that can put lives at risk very concretely. And so we are also supporting healthcare organizations to tackle that challenge.
Okay, thank you. Well, we will have time to talk about the challenges and how to face them. But it seems, and during the whole morning we have seen that this is a great opportunity, not only for companies, but also and especially for humans, for us, to have a better life. So I would like to go deeper with you, Pilar, through how is AstraZeneca really harnessing this great opportunity.
Yeah, well, we are trying to, well, firstly, sorry, I would like to thank you also for having me here and giving us the opportunity to share with you, our thoughts on what is coming or what is a reality now, The main effort that AstraZeneca, that the company has done in Spain, is located in Barcelona in research and development. And because what we are doing there is trying to use artificial intelligence and also, different technologies in order to accelerate clinical trials development and results in order to accelerate innovations to patients. And also because we are pretty aware of the threats and also that we will have to assume in coming years with chronicity, with an aging population, with very high cost treatments too, because technology is also providing us, and the healthcare systems needs to be sustainable. So we need to firstly shorten those time and shorten the timing, and also making the process much more agile and much more, to speed it as much as possible in order to be able to provide this and make this more efficient, so that the government has the results earlier and we can commercialize our products earlier. Of course, this also has to be aligned with the European health data space, which is really challenging, the regulation, but also because the health sector is not only impacted by this regulation, but also there are many others, like the pharma package, like also new environmental rules. So there is a lot of things coming. So we don't want to miss the chance of having technology to support us. And one of the reasons why the hub is located in Barcelona is because the supercomputing center is there. So there is also opportunities of collaboration, not only regarding health, not only because it's a good opportunity and good environment for clinicians and researchers, but it's also high-tech opportunities. That's the main reason why we are located there. And we also support small companies. There is a hub in Madrid, an innovation hub, and it was open like 2 years ago also. And what we do there is to support small startups in order to give them the opportunity to go to the health system, because we have seen that this is the differentiation step, and it was something that they couldn't achieve easily. So we are trying to help them to get to the clinicians and to get to the patients. Of course, we do this, as you were saying, we are very, absolutely convinced of how lucky we are in this private and public collaboration with both hubs, but especially with the hub in Barcelona. I think that this was one of the lessons learned after COVID-19, how this was very, very important, and it was the only way to face what is coming and future threats, and not only regarding health as health, but also as a sector, as an economic sector, and also as, with the perspective of the competitiveness and the need of the different companies to be at the same level at the United States or other countries, no? With the different geopolitical situation as we are living nowadays.
Very interesting. Yeah, you're doing a great bit. Well, we've been talking about AI all morning. You have mentioned it again. And Clara, what do you think that should be done in order to reap the benefits of AI?
Well, I think there are really three things, and so I have to say, some of these topics were already covered in the previous sessions, so it won't really be a surprise. I think we need really, AI infrastructure investments. We need robust data governance frameworks, and we need secure AI development. We've been talking this morning about the need for computing power for AI. I was glad to hear the Commission talk about the EU Apply AI strategy. I think the healthcare sector is the first sector addressed in the strategy, and it's, the intent to roll out AI-powered advanced screening centers to improve the early detection of cardiovascular diseases and cancer. I think it's really powerful, and that's exactly what we need as a basis to really be ready to reap all the benefits of AI in healthcare. Then we've been talking a lot about data, the reuse of healthcare data for AI training and development. It's governed by various regulations at European level, whether it's the AI Act, the European Health Data Space Regulation, or the GDPR. It's quite complex. So I think going forward, I don't know if this is going to address some questions, but I know that a couple of weeks ago, the European Commission proposed a digital omnibus package, which proposes some changes to the GDPR, especially around, making it easier to process personal data for AI training and development based on legitimate interest. And I wonder if this is perhaps going to generate a bit more flexibility, whilst obviously, protecting data as it should be, with all the safeguards that are necessary, but perhaps making it easier for some of the data to be used in AI training. And then final point is really security. AI is a really powerful tool to help the cybersecurity industry better fight attackers, but unfortunately, it's also a technology that is being attacked itself.
Yeah.
So we want to make sure that, we can collaborate, the public sector and the private sector together, to have, secure development principles for AI, whether it's used in healthcare or elsewhere, actually. But we want to make sure that governments and the private sector can do things like, pre-deployment testing of AI models, and post-deployment as well, so that the systems are fully validated from a cybersecurity point of view. And we think that's really important. So the importance of public-private collaboration around this is crucial.
Yeah. We'll discuss about public-private collaboration because it's key in this. No, but at this point, I'm talking about AI. In these times of AI, we know what we have to do, but we must be effective and move fast. So, Pilar, what do you think about the importance of innovation and investment in research and development in order to really accelerate these processes, these new change of processes?
Yeah, well, as I was saying, that's one of the main works that we are doing in Barcelona. I mean, if you know that in the medicines regulation, there are different phases for clinical trials, and what we are trying also to do there, which is really different, is that we are trying to substitute like the traditional lab by something virtual. I mean, by different digital models in order to do a much more effective recruitment and also to get the data analysis in a shorter time. No, it is also true that that with the situation as it has gone through, no, lately, mainly because of the Trump winning the elections and everything. Although I don't want to make this anything political, no, but it's true that the game has changed. It is also true that I think that the European Union and Spain and the companies and the European Commission, etc., we have to be much more conscious on our role and the role we want to play in future. And we need to react, as you were saying, we need to react the soonest the better. We need also to differentiate. We need, and so why don't we do it, you know, with AI? I mean, not only being this as an stopper, but seeing this as an advantage, no? As how are we going to make it possible among 27 member states, no? And I don't know if we should be focusing on manufacturing, but I think that we should focus on innovation, on what we can do better and how we can create things better, faster, in a much more efficient way. I think that that will give us, as a country and also as a union, much more opportunities than only having a manufacturing side, no? Which is also important. I mean, I do agree that this is important with the open strategy and having the capacity to answer to threats and everything. But also it's time to differentiate, and it's time to get advantage of what we know, and we know how to do it and how to do it right. We have different reports. We have daily report, we have letter report, we have editorial report. So it's time that we react and try to do our best and taking advantage of all these works that is being done, and try to speed it. I mean, it's difficult, of course, because as she was speaking about data and healthcare data, and very highly, I consider highly sensitive, and it's very, very difficult, no? And we've seen that in the European health data space negotiations, particularly with the secondary use of data. But still we have to keep on working on that, to keep on supporting, to keep the dialogue with the public administration, with the companies, with high-tech companies. And we need to listen to each other in order to advance soon. And of course, not leaving the patients behind. No, I think that patient associations are very, very important. And I have also heard some patient associations saying that putting at the same level data sharing with data sharing, they call it data donation, because they compare it with organ donations. You know that Spain is champion in organ donation, so they speak, and I think that we should be aware of that. Of all the possibilities that that sharing this data will have in coming future.
We've been talking about that this morning also. But, well, Clara, you have mentioned something really, really important, which is the cybersecurity thing. So earlier this year, the EU came forward with a plan, an action plan, on cybersecurity of hospitals.
Yes.
So, I'm following your previous words. Do you think that this plan fits to purpose, or do you think that there should be done something different or something more in order to ensure the cyber resilience of the healthcare providers?
Yeah, I mean, the EU Action Plan, I think, was part of the work done by the Commission in the first 100 days. So it was really priority work being done at the beginning of the second von der Leyen Commission. And it did come with really interesting ideas, especially around the creation of this new European cybersecurity support center for hospitals. So that will have a catalog of services for hospitals around prevention, detection, and rapid response and recovery. So quite an overall package of services that hospitals can benefit from. But from the perspective of Cisco, we feel like there is an issue that generally remains unaddressed, and especially in the healthcare sector. It's the existence of obsolete IT devices and systems that are still connected to critical infrastructure networks, although they no longer receive security updates from the manufacturer. So we see it as an open door to attackers. And actually, so we know that there's an interesting stat. So 60% of EU cyber breaches in 2023 exploited known vulnerabilities for which there were security updates, they were available, but they hadn't been applied. So, and so we think that there's a general issue around these end-of-life devices that are still connected all around our critical infrastructure in Europe. And so we recently commissioned a report specifically on that, which is called Update Critical. And it's really around the exposure to these risks that are generated by end-of-life devices. And one of the conclusions is that healthcare is probably one of the sectors that is the most exposed to these cybersecurity risks. And you can easily understand why, because patching and replacing legacy devices and software is made more difficult in healthcare, in acute care environments where you can't really afford any downtime for your IT equipment. So we completely understand the challenge that this could represent. So we want governments to at least start with encouraging hospitals to make an inventory of their devices so that we can understand precisely how big the issue is. So how much of your technology assets are approaching end of life. And once you've made that inventory, you can also apply mitigation measures. So perhaps network segmentation to avoid the attack to spread across all your systems. And also we'd like governments to apply funding incentives for hospitals to be able to rip and replace this outdated equipment that is generating vulnerabilities.
So you're talking about really big investments and public-private collaboration.
Yes, absolutely.
Yeah. What do you think about this, Pilar, the public-private collaboration? What role should it have in this open ecosystem with all these things happening?
Yeah, well, I think it's more important than ever, no? I think that it's the only way in order to get real advance in healthcare, especially particularly in a country like Spain, where of course there is a lot of people that is averse to the private healthcare system, but everybody is in public system too. I mean, sometimes people has both, but they don't have private without public, for instance, no? And this is particularly important coming back to clinical trials and to innovation. For a pharma company, in order to make big investments in a country, you need also to be able to develop your clinical trials here, and also to be able to put what you have offered to certain patients available to all the patients, no? And for this, you need also the support of the decision makers, and also flexibility, some kind of flexibility also in the rules in order to make this faster, because as we were speaking, the situation has changed. Now everything is different, and Spain is still, I think, for AstraZeneca is #1 in oncology clinical trials, and that's even before China. And I think it's the second in the biopharma, which is what is not oncology in our pipeline. But we still need we still need to make this collaboration closer between and I think, as I was saying, as I was saying before, we need to listen to each other. We need to listen to the administrations. They need to listen to us, and we have to be able to advance in common terms, no, in order to make the sector competitive, and also to make it possible to work better for patients.
Yeah. I think this is one of the takeaways of the today, no? The
Yeah.
need of public-private collaboration. We are running out of time because we only have 30 minutes for this dialogue, so I'm gonna mix the next two questions. You can choose, or you can answer both of them, but just in 1-2 minutes, please. I would like to know a little bit about digital skills and talent from your company's perspective, because it's true, no, technology is key, and I don't know if we are doing the necessary in order to have the right people doing the right thing with the updated digital skills. And on the other hand, and just to summarize and to close the dialogue, I would like to listen a good piece of advice for a CEO that could be leading a company undergoing this process.
Oh, wow.
Yes.
Should I start?
Yeah.
On skills, very quickly, again, public-private collaboration, I'm afraid. We're going back to that same topic, but I mean, Cisco is playing a big role there. We have something called the Cisco Networking Academy, created in 1997. Since then, we train 24 million people around the world with cyber, IoT, AI skills over the years. And we have made several commitments to really play our part in helping bridge the digital skills gap around Europe. I'm actually, you know, if people in the room are interested, we would be very happy to deploy a specific program for healthcare around Europe. We have done some work in Ireland. We have done like quite a big project in Australia, but we haven't really done anything formal around digital healthcare across Europe. So if you're interested, please come to me, because we have a really interesting program that we'd like to also put to the benefit of healthcare. My advice to the CEO would be for he or she to really focus on 4 things. Ensure you have state-of-the-art connectivity on your premises. Make sure you have robust cybersecurity, strong data governance frameworks, and have a skilled workforce, because that is so crucial.
Okay. Very useful.
Yeah, and in my view, just to recall a little bit what we have done in the hub in Barcelona, we have recruited there almost 2,000 people now. It was a really, I mean, it was done in a very, you know, agile way. This was done in less than 2 years. And the investment there is 1.3 billion, and we have people for 60 nationalities. So this leads us to your question. There are gaps. We need biotechnology, more genetic, you know, people specialized in genomics. The thing is that when we have these people, we don't have so many problems in the private sector, but there are problems in the public sector where they are needed too. But they can get, you know, they don't fit really in the system, because the system is not think for nowadays, it's think for 20 years ago.
Yeah.
You know, so this also needs to change. Otherwise, we are not going to understand each other, public and private, you know. So we have so this leads us to my advice to the CEO. Just speak to each other, speak to scientific societies, to decision makers, speak to high technology companies, speak to patients, speak to, you know, and listen a lot, and you know, and trying to, you know, sometimes we are in this situation, no, nowadays, where everything is very political or very, you know, fragmented, and we need to focus on what is important, and also the points of agreement in order to advance. This is what we need to do.
Okay, thank you. Thank you so much. It's been a pleasure to share this dialogue and conversation with you, and we must keep having this conversation.
Yes.
Okay, thank you, Pilar. Thank you.
Thank you.
Thank you so much, Pilares.
We can leave.
Clara. Merci bien.
Gracias.
Thank you so much for this inspiring contribution on the path from innovation to implementation. So our next plenary focus on one of the pillars of the future European health data space, trust, governance, and interoperability. Some words are difficult, even for me. How can we ensure that health data works for citizens, research, and innovation while protecting privacy? So this is the main panel for you. To lead this conversation, I would like to welcome our moderator, Nathan Carvalho, and he is Senior Research and Innovation Manager at Digital Europe. His panelists are Fulvia Raffaelli, Carola Schulz, Janes Benza, and Christian Muelendik. Nathan works at the crossroads of digital policy and EU-funded innovation managing projects that strengthen Europe's cybersecurity, data sharing, and AI capacities. So I think we are now okay to welcome our panel. Thank you so much. And Nathan, welcome. Careful.
Obrigado. Are we good? Okay, nice. Well, thank you for the introduction. It is indeed a privilege to open this plenary with this very nice lineup of speakers, especially knowing the work it went to prepare this summit together with the European Commission and our sponsors. It is with the support of the European Commission and our sponsors that we are able to sit here today and speak on these different challenges that will help us to understand how to implement the HDS a bit better. So today our focus will indeed focus on the HDS, and we want to talk more on the HDS applicability, its challenges. The role of speakers was set because we often complain that we work on silos, so this is the reason today we have policymakers, authorities, industry, and also projects and research joined together to discuss and hopefully have good collaboration and help us to understand how to move forward with the implementation of the HDS. So first I would like to start our plenary introducing our speakers. So first I would like to introduce Fulvia Raffaelli. Fulvia is the head of unit at Digital Health at DG Sante at the European Commission. Fulvia leads the European Commission policy and coordination work on digital health and the European health data space, promoting cross-border data use, interoperability standards, and citizens' control over their health information. Fulvia has been a driving force in connecting policy, innovation, and governance across member states. So, round of applause for Fulvia, please. Then we have with us today as well Hela Gariani. Hela is the delegate for digital health in the Ministry of France. She co-leads the France Digital Health Delegation, overseeing national governance and strategy for digital health. She also co-chairs the EU eHealth Network, guiding member states in implementing interoperability and the HDS. Previously, she led the deployment of France's national EHR platform, Mon Espace Santé, I hope I'm pronouncing correctly, and contributed to digital public service innovation in France. So, thank you very much, Hela, for joining us today as well. We also have Carola Schulz. Carola is a senior research consultant and project manager at Empirica and project leader on the European health data space. Carola Schulz led work in new projects advancing various aspects of the HDS, such as the European Electronic Health Record Exchange format, secondary use, and cancer data. Carola is experienced in stakeholder engagement on data use and interoperable infrastructures connecting policy, technology, and real-world practice. So thank you, Carola, also for joining us this afternoon. We also have Yannis Benza, is the CEO in OpenLine at Vitali. Yannis has substantial experience in building proactive platforms based on open standards, leveraging clinical collaboration and patient inclusion in a regional and national setting. He founded a scalable product organization enabling data variability principles. Yannis has led multiple projects enabling secure health data exchange between institutions, enhancing care coordination and interoperability across Europe. So also thank you, Yannis, for joining us this afternoon. Finally, we have Christian Muhelendik. I hope I'm pronouncing, sorry for my German. As he's a scientific partnership lead at Johnson & Johnson MedTech. And Christian combines clinical training and industry leadership, driving innovation through major European public-private partnerships, such as IDERA. His work focuses on accelerating research, data-driven collaboration, and the adoption of advanced digital health technologies across Europe. So thank you very much, Christian, for joining us today as well. So our session today will focus on the heart of Europe's digital transformation in health, the European health data space. Our discussion will focus on how member states and stakeholders can turn this vision into a reality, building governance, security, and interoperability frameworks needed for both primary and secondary use of health data. We will explore how to link diverse data sets across borders, empower data-driven research and innovation, and ensure that the patients remain in control of their information at every step. So I will not I'll go directly to the individual questions, which will be the first part of our plenary. Then we'll have some open questions for our speakers. So Fulvia, if I can, I would like to start with you, if that's okay. I would like to start asking you, what are the European Commission's current priorities to ensure that the European health data space moves from regulation to practical implementation, and how will it help the member states to align governance and infrastructure for both primary and secondary use of data? Thank you.
Well, thank you very much, first of all, for organizing and inviting us and for bringing together different stakeholders. At this point in time, we have only one priority, which is to make the European health data space really a reality for the citizens, a reality for the healthcare professionals, a reality for the different stakeholders, hospital manager, EHR system manufacturers, all the ecosystem that is not only existing but growing on an incredible speed around the use of health data altogether. And to do so, we feel a lot of pressure in this point in time because actually the ambition is enormous. The project is very big, but we are full speed on it. And I would like just to mention 3 work streams that are at the moment organizing our work. Well, first of all, we are at the moment defining all the technical specifications, so really going down into the details on how the European health data space will work. And we work very close cooperation with the member states, but also with a number of stakeholders to define those technical details in these famous implementing acts, which are at the end of the day small, let's say, more technical regulation that actually define the details on how the different aspects of the European health data space will work in the future. We're doing that with a lot of support from joint actions, from projects, different areas where we really try to involve as many as possible stakeholders. And I'm sure you are all, in a way and another, been touched and involved in those different projects. The second work stream is the one that is, let's say, under the direct responsibility of the European Commission, which is about setting up the central services, of course, as we call it, but also to make happen the digital infrastructures that will connect and make the European health data space and make actually the data accessible from the different, across different member states. On primary, you certainly know that we have up and running the voluntary system, system, myhealth.eu, which are, of course, the basis for any future, let's say, development and upgrading of the system. But for secondary use, we are starting from the beginning. So we have already started having releases of the central services, and there are a number of other areas where we need to gain experience. This is the second, let's say, a big work streams on which we are working on today. And the third is really how to prepare the member states, but also to prepare the different actors and to communicate about the future rights, but also the future obligations that will actually impact many of us under different roles, as a data holder, as a let's say, as a data holders or HR system manufacturers or also innovators on data users side. So communicating, exchanging of good practice, capability buildings across the member states, exchanges of experiences, all that is also a very important work streams on which, again, we're working with the member states, but also with many of you, including patient associations and association of healthcare professionals altogether. So a lot of work. I feel the pressure. I hope you also feel the pressure, because we need you all to work with us in making that a reality.
Thank you, Fulvia. Thank you very much. It's interesting to hear the perspective from the European Commission and all this work that you're doing from the European Commission side. And on this regard, maybe we can hear more about from a member state side. So Hela, maybe I can ask you, as co-chair of the EU e-health network and lead for France's digital health strategy, what do you see as the key governance and coordination challenges for member states in implementing the HDS? And how do you believe how European cooperation mechanisms can support more harmonized progress?
Yeah, thank you very much. So indeed, I have the pleasure to co-chair with Fulvia's, let's say, community of digital health authorities at the national level, and we meet, let's say, twice a year, and we have a collective and common work plan to make sure that member states are actually ready for the EHDS implementation, because just as Fulvia said, of course, we have the pressure at the national level to be ready on time. And the delays that are stated in the regulations are pretty ambitious. For example, in France, to make sure that we have the primary use data sharing system available at the national level, it took us 5 years and 2 billion investment to make sure that data is actually structured, that it is shared, that the healthcare professionals have the right identification tools to make sure that they access the data in a secure way, and also protecting the medical secret of the data that they are accessing. And this is only for primary use. So now that we have to do pretty much the same for secondary use and trying to, let's say, build all together a common governance model at the level of every member state in Europe, the challenges are clearly there. And the, let's say, clarity, the fact that the governance that we put together with the HDAB, et cetera, at the national level needs to be the most clear as possible to make sure that the data is actually used, because we will have that kind of, let's say, constructive cooperation, competition among member states to make sure that our national systems are the more clear, the more legible from the exterior for any kind of actors that want to reuse the data. So this is clearly one of our challenges. And as I was saying, for most of the member states, the COVID was clearly a wake-up call, and there was, like for the last 5 years, a clear acceleration in regard of like the conscious of the importance of data for primary use, of course, for data sharing, but also for secondary use. And now that the conscious is there, now that the regulation is there, what we need to do is to put together the actual policies to make sure that our health record systems vendors are ready and on time with the actual exchange data format specification in place, that our healthcare systems are also ready, meaning that every healthcare professional has actual tools to access and exchange the data, but also that our technical infrastructure for secondary use are actually there when it comes to AI training or any kind of big, massive data exploitation at the national level and at the European one. And of course, to do so, we also need the funding, and we are, all of us at the member states level, trying now to contribute actively in the definition of the next MFF, the next multi-annual financial system at the European level, to make sure that actually digital health as a common opportunity for European growth and also for better healthcare at the level of the Union is also a good place for public investment. And so our hopefully our next budget also implies that and helps us at the member state level to be ready on time. That's mainly it.
Thank you, Ella. Thank you for the interesting insights. And indeed, when it comes to digital health and European growth, we also have Carola with us, who is working on different EU-funded projects that deal with digital health. So, Carola, I wanted to ask you also, from your experience managing these large-scale EU projects in health, what are the most pressing technical and organizational challenges that the member states face when setting up EHDS-compatible infrastructures, and how do you see projects can help overcome them?
Yes, thank you very much for inviting me in the first place. So as Nathan said, I work at Empirica Technology Research at the intersection of research and consultancy. And we are heavily involved mainly in two of the 3 points that Fulvia mentioned. First of all, in a project that helped define the technical specifications, and also in the third point, preparing capacity in member states. And based on these projects, insights that I've had from stakeholder work mainly is, again, not surprisingly, overcoming challenges and silos on several levels. First of all, overcoming silos in having an overview of the actors. So many member states representatives say, okay, I guess many data holders are not aware that they are data holders and what this entails by the EHDS. And many representatives of future health data access bodies say, is it our task actually to have an overview of the data users and the data holders, and how do we do that? So this is one point, having an overview of the actors in the health data system and who needs to be involved and how. Secondly, the connection of private and public sector. This has been mentioned already in previous panels today on how to bring this together and how to make sure that these data systems talk to each other. Of course, it depends a lot on the member states, but something that has been mentioned a lot. And then third point for me personally is the connection to disease-specific communities and disease-specific practices. Specifically cancer, because the cancer community, of course, receives funding from special sources like the EU Cancer Mission, and also the cancer research communities has been at the forefront of developing certain strategies and established workflows for secondary use of health data. A lot of this can help and has already helped establish the EHDS structures, but the question remains how to integrate this in the EHDS structures on national level. I work a lot about this in cancer data, currently in the project Candle, which sets up national cancer data nodes. And ultimately talking about silos, Hela and other speakers mentioned the coronavirus pandemic as a wake-up call. But I want to remind you of another pandemic. Today is 1st December, World AIDS Day. So 40 years ago, before I was even born, there was a huge crisis happening with a lot of different silos in research, healthcare, also certain industries, policies, all of this mixed with a huge stigma around this. And this at a time where all these actors are still figuring out how it's transmitted, what are effective protection measures, and also coming into this a lot of discrimination against groups of the population. So I would like to remind us as well that we should also look beyond things that are in our recent past. Thank you.
Thank you very much, Carola, and bringing this insightful practice from projects to see how it works from a policy perspective in practice. So I also wanted to ask Yanis, from your side, how can integrated patient-centric data ecosystem support this EHDS vision of connected care, and what business or governance models are needed to make such systems sustainable across borders?
Thanks, Nathan, for inviting me. And yes, I'm here maybe because I'm closest to the ground or first-line operations, scaling the company from the small startup through a scale-up to now being an enterprise. So let's start with the good news. So for sure, in the last 15, 17 years that I'm around this industry, I can share that Europe is far beyond proof of concepts and pilots, which we were in at that time. And this is not just in the most mature countries, technologically mature countries. I think that the EU Commission did a great job with the various incentive programs, being also resilience and recovery funds, being the EGS and everything that was coming under the last two presidencies. So I see that very similar practices being implemented in those, let's say, countries that started first and the ones that are now adopting the technologies and principles very rapidly. But let's go to where the scalability really happens, because this is what EHDS it's all about. So, and we shouldn't be speaking about grants, but rather value. So all the scalable regional or cross-regional national projects have from the very beginning or in the deep of their existence a very well mapped value, which was originally done for the business cases. That was then pivoted into various plans and steering committees in the decision making, and at the end, and which is most importantly, ended up in a successful user adoption, because we have to understand that technology which is not adopted by users, it's not producing data and it's not producing value. And you know, I still see also nowadays that technology is being discussed on the level of single organization, which should be, let's say, prevented or suggested not to. We are speaking here about the cross-country record, but the groundworks are still, let's say, in if we are going to do it regionally, cross-regionally, and nationally. And I think that this is where the most of the opportunities and value still lies. Then what we should be also taking a lot of attention of is going horizontal, so meaning building horizontal platforms, as the keynote speaker said, but we still, let's say, get into the conflicts of getting in the vertical platforms or solutions that support a single specialty and are not always, let's say, data open or data available. And the fourth thing, which I see, let's say, it's a cultural thing, and maybe also we will touch it during the procurement discussion. So the organizations that are procuring, so the customers and the vendors, should be more leaning towards a partnership relationship rather than a classical vendor and customer ones. Only in this kind of environment, the clinical teams, the IT teams, the institutions, the patients can act as, let's say, stakeholders where everyone can say, this is here for me. And only in this kind of innovative environment we will be able to leverage the primary use of data as well the secondary.
Thank you, Yanis. Thank you also for your insights on the scalability and sustainability of solutions utilizing the HDS. So, Christian, we would also like to hear from your side, based on your experience in medtech innovation and strategic partnerships, what do you believe the industry requires to ensure the implementation of the HDS what could be the key enablers to support the development of EHDS-ready systems that are interoperable, safe, and grounded in high-quality data?
Thank you for the question and thank you for the invitation. I think before I go into your question, I think we should look into really what is the EHDS. The EHDS is not just another program, it is really the core of probably the biggest revolution in healthcare that we're looking into.
Oh. I think the solution is coming our way. Yes.
Okay, then I've got something to hold on to. That's not bad either. So what I was just going to say, to really reflect upon what the EHDS really is. The EHDS is for Europe the core of the biggest revolution in healthcare that we've ever seen. I mean, there has been anesthesia, there has been penicillin and the like, but now we are really entering a completely new era. Potentially, we are even able to go into healthcare at one stage, because currently we are driving sick care, looking at people that are sick. With data and digitalization, we can really drive personalized healthcare, making healthcare much more efficient and effective, which will also have significant impact on the scarcity of resources that are out there, and also looking at the aging population. I think this is really, really an amazing time we are in, and it's fantastic that we can drive this, and a big thank you. Having said that, I think on all of our thinking, we should put the patient in the center of our acting and doing, and then seeing where and how does that drive forward. And saying that, I think data travels at the speed of trust is also a very good lighthouse to go along with. And then going into your question, what would industry need, or what would anyone need working in that field? It's about how can we ensure that there's value for the individual player? Because as you just said, if there's no value, why should I ever do it? So I think from an EHDS perspective, I think what is very important, speed up digitalization, make patients see what is the value for them. If I come here to Madrid, break my leg, and can actually go to any doctor and have my data presented to him or her, and then getting treated in a better way, that's enormous value. If something happens with my family and that data is connected, that's enormous value. So I think starting from there is the prerequisite for the ones that make their data available as an individual. Then for other data holders, I think it's important to make access available, that it's clear regulations, clear ways on how to drive access to the data. However, also protect the personal data, as well as IP protection or any kind of trade secret. Again, what's the value? Why should I work in it? And then last but definitely not least, it's the right governance model. So up until now, Europe is very much fragmented. You're playing huge efforts in order to defragment it, driving a EU of data. How can that be driven forward? We have an enormous opportunity. We are in Europe, have a solidaric healthcare system. The data of our citizens is all there. In hardly any other nation do you have the whole population treated. That data is there. It's very diverse data. How can that be brought forward? But that can only work with a clear governance model. Interoperability needs to be there. The quality of the data needs to be there, and then really being aligned. Having said that, it's all about collaboration, because this is something no one can do alone, and I think this panel reflects it also very much, who you brought together. It's about working together in the right direction.
Thank you, Christian. Thank you very much also for your insights. Now we will enter the second part of our panel, which will be the discussion questions. It will be an open question towards our speakers. Of course, we will allow you to interact between yourselves as you wish. Our first question then is, how can Europe ensure that both primary and secondary use of health data are implemented in ways that respect privacy while maximizing public value? So perhaps, Fulvia, you could start perhaps highlighting how the HDS regulation ensures lawful privacy, preserving primary and secondary use, and explain how the Commission safeguards this governance approach.
Thank you very much. I would like actually to start from what you said about the dimension, the European dimension of this project, because I think this is very, very much central to us. This is in a time where actually we see fragmentation and times where everybody's thinking about well, its own perspective, let's say. I think that the power of the European health data space to bring together citizens is enormous. And bring together, it is designed from the beginning with in mind a European dimension. First of all, in primary, and that's where I'm coming to the trust, to the creation, it is primary use in the HDS is built around the empowerment of the patient, but even more than the patient, the citizens as such. So we and all of us European citizens will have a complete control on our data within the country and across borders. And all these data which are electronically recorded at source for the purpose of our care, also of our well-being and preventions, dimensions. So all data which are recorded in our life would be under our own control, and we will have an access, free, immediate, in an interoperable way, and wherever we are in Europe to this data. So it is, when I say empowerment, it's not only controlling, but it's also ensuring that we take a more active role in managing our own health. So we are more proactive in the system. And the system that we have designed, of course, it is at the same time to fully protect the privacy of this data, so that you see also who has access to this data, for which reasons, and wherever these data are considered, so that you have a full picture. But you also are able to download or to have those data in an interoperable format, so that you can take it forward in the different applications or uses you want to do it. In the secondary use, it's even this concept of solidarity goes even a step further. And I like the reference that was made before to the concept, the similarities to the idea of organ donation. It is a bit of a data donation, because by creating a process that ensures that those data are accessible only under very strict conditions, only fully anonymized or pseudonymized, with a very strong scrutiny of the national authority for secondary data, under very, very strict conditions for the identification of the uses that you will be able to make out of those data, each one of us is called actually to make his data available for the innovation and research, so to improve the conditions of everybody. So I really like to say that this trust that we have at the center of the HDS, it is also with in mind this European concept that we are all part of a same space in this case. So yes, trust is really centered in that context.
Thank you, Fulvia. Thank you for also sharing with us how you're doing this empowerment with users for trust. On these regards, we can maybe ask Hela, from a member state's perspective, how do you balance GDPR, national rules, EHDS requirements, using France's governance model as an example?
Yes, so the regulation, actually, EHDS, is kind of the same ethical principles that we had in the French law regarding the access to data, meaning that the citizen has to keep some kind of control of its data, knowing where it is and who's access to what. But then there is a second pillar of the, let's say, governance when it comes to data usage around Europe that is stated by the new regulations is the transparency. And I think that gives a lot of right and also obligation, right to users of data, to citizens among their data, but also obligation for data holders who are not always aware of the roles that they have, specifically, as you said and mentioned, with GDPR. So for us, really, the regulation brings some kind of clarity to what we can do with one of our most sensitive data, which is our health data. And just to say a few words on the, let's say, social value of this data. For example, everywhere around Europe, of course, our healthcare systems are financed on a different basis, but most of our healthcare systems have some kind of social providence behind it. And at the end, the data that is produced by our European healthcare systems are always the fruit of the cotization, somehow, of the patient as a citizen and the businesses all around Europe. So this health data is actually capital that we all have. It belongs to all of us. So this is why having some kind of common regulation on how we use it was something that for us was particularly important. And tomorrow, in applying this regulation, for example, in a daily basis from a hospital to a citizens with the transparency portal about what is done by the data, I think it also strengthen the conscience that this data actually belongs to us, and by us I mean collectively. And this is also why I think that it is important in the way that we put together this regulation in a concrete, pragmatic way all around Europe, that we keep in mind that it needs to help us at the research level, at the business level, at the scientific level, to, let's say, have a collective control on how data is used, and also to help us bring the innovation that our healthcare systems need, and that as European, we still have a say in what kind of innovation we want to see foster with our data for our citizens. So this is something that, for me, will bring also trust. Because if we consider that as a collective capital, that we are investing collectively and that our researchers, businesses, healthcare professionals can actually use to build some kind of control over our destiny when it comes to the future of our healthcare system, this is how we can build trust in the way we manage health data at the European level, and with everyone having its role, from the citizens to the healthcare provider, tomorrow data provider, to the actors who are reusing that data in the context of the regulation.
Thank you, Helen. It's interesting to hear how you balance these different requirements. We can maybe now ask Carola, because Carola, you work on these different projects, so perhaps you can also bring some practical challenges and solutions from the projects that you work on when implementing consent, access controls, and secure secondary use environments. If you could comment on that.
Thank you. First of all, I suggest not to see this distinction between primary and secondary use as strict. In our project, we interact with many actors who do not see it as strict as in the European policy level sometimes. For example, on member state level, in some member states, it's literally the same people involved in primary and secondary. And also in stakeholder engagement, many do not see this distinction as strict. So this is my first point. My second point, of course, links back to the important topic of trust. There are already some very good citizen engagement, citizen education initiatives. I just talked to Hela before this panel that the French Health Data Hub has been doing some interesting citizen education sessions on this. For example, showing a concrete record of a pharmacy visit of a citizens and then showing them exactly, okay, this is the clear data and this is the data, the pseudonymized data that goes to the health data hub, and that's what we do with it. I think that's awesome. What is also very good and what we can learn from is Data Saves Lives, and also national Data Saves Lives operations like Data Saves Lives Germany. They have done amazing work in, first of all, contributing to shaping the EHDS from the citizen part, the way it's now, and also in creating citizen education and consultation material that can inspire us in this regard.
Thank you, Carol. Thank you very much. Interesting to see your comment on the non-distinction between primary and secondary use. That's very interesting to hear. Maybe we can also go now for Christian from an industry perspective. Maybe you can let us know how do you see the industry can use health data responsibly for research and innovation while maintaining strict privacy, safety, and data quality standards.
Yeah, very happy to do so. You can hear me? Good. I think one step needs to be said. We as healthcare industry, I think, is the same thing as the finance industry, have been dealing with confidential and very protective data for a very long time. And we have got enormous organizations in-house that are constantly ensuring that data is protected, and those organizations are evolving continuously. Looking where we are now from a healthcare perspective and what I said before, if we look before, we had classical pharmaceuticals and classical medtech, which was more analog kind of solutions with hips, knees, etc. Now we're entering an era of digital healthcare. If we look into which kind of areas do we see AI applications or technology that is really moving forward, that's mainly in the area of radiology or any kind of imaging. What's the underlying reason for that? It's the completeness and consistency of the data. For imaging, you've got the DICOM data, for example, or Apple has within the Apple Watches some data that they collect consistently from the ECG. It's consistent. Or going in a different direction. Why is Mark Zuckerberg building his huge AI farm or whatever he's calling it? Because he's got the underlying data which is consistent and complete as he is defining it himself, what it looks like, and thereby can get the insights. In order to get towards personalized healthcare, in order to then being able to use AI and having my health twin somewhere sitting out there, someone that has similar problems like I had, and to thereby allowing for an analogy to saying what could be my problem, learning from someone else. It's important to have data from many people. So having said that, it's important to do so. It's always about the quality of the data. We need the quality of the data, we need the completeness of the data, and the underlying data consistency, that not in country A it's a very different one versus in country B versus in country C. It's all about bringing it together and making it comparable, that we then have got not a defragment area from that direction, and I think then we can really go for the forefront. Again, in Europe we have all of us treated in a very similar way. I think that's an enormous opportunity, and then opting out is also a discussion within that, where can bias come from, because we should have as many people as anyhow possible in it, and we as industry, for example, for research, etc., we are not interested in anyone's individual data. We are interested in the insights of that data. I always take the analogy from Google traffic. There's someone in a traffic jam, I have no idea who it is, but it helps me to avoid the traffic jam. Someone gives the data, I don't know who it is. And other times I'm in the traffic jam and allow others to then avoid it. Again, take this analogy and transfer it into healthcare, how we can get there and how we can take it forward. I think these are really needs which will elevate healthcare significantly.
Thank you, Christian. Thank you very much. It's nice to hear also more from the industry perspective. And indeed, I think working with high quality data is a challenge for everyone who is working with digital health innovation. Okay, now we can go to Yannis. Perhaps you can also give us some concrete examples on how hospitals and regions and countries can implement privacy by design workflows and secure data access in real clinical settings?
Yeah, thanks. So I think that everything starts with building the national consent registry, which would for sure first serve the institutions themselves, the regions and the country. And by doing that would be also the, let's say, the main pillar of contact for the EHDS to support the opt-in and opt-out consent option. Yes, it was said quite a lot that us citizens, sometimes patients, should be aware of what a consent is and what opt-out and opt-in brings in both aspects. But it's also something more to be aware of, that just certain countries in Europe are well aware on how to deploy the consent into the final, let's say, operative ground. And I think that the countries, maybe EU, should be also taking attention that, yes, people understand, which means all the IT department, all the governance on the regional level, all the vendors, that they build their proper consent mechanisms as part of their, let's say, roadmaps and future. Another thing that it's, and here I have a good practice, for example, from Netherlands, we were, let's say, stumbling on our own toes for quite some time, but then the ministry came with a nice program which is incentivizing some small, as they say, proof of concepts, and one of those is also managing the consent. And it's not about those couple of grants that you get, but it's more creating the ecosystem of vendors where they can start testing the consent in the real world, which makes then the vendors and the authorities enabled to apply those things. And I think that every EU country should look in that direction. Then it's pseudonymization. It's a word that is difficult per se, and I think that also that part we should take a bit more of attention to teach us, Europeans, what that means, and that means actually that you're dividing the identity of the person from the data, and that this means that your data is really secure because nobody can really take it together, and in such a way could be really used for valuable purposes without being really identified. And then the third thing around the privacy by design, for sure we European are designed to be, let's say, federated. And also our system is designed to be federated. What is the positive part of that? No? So the organization that created that data sets, it's also then in charge for nurturing that data set throughout the years of that person's or patient journey. And that means clinical nurturing and maintenance, but also from the security perspective, from the consent perspective, from accessibility perspective, from having the auditing of who was accessing that data and so on. And all this, it's in the basis set in the GDPR and all the other national, let's say, consent frameworks that we all have to adhere. And at the end of the day, this federated system, it's much more, let's say, scalable and especially secure than the ones that are centralized and that are owned by nobody, if we say so.
Thank you, Ernest. Thank you very much. Okay, mindful of the time, I think I can make one last open questions for all of you. And then if we have a couple of minutes left, maybe 1 or 2 minutes, I can grab a question from the audience. So the next topic would be what governance models could guarantee consistency and coordination among the member states while allowing for flexibility for the national realities. So Hela, maybe I can ask you first if you could provide us some a perspective on the member state coordination challenges, and how do you see the e-health networks support harmonization while respecting national structures?
I think that the regulation gives us a pretty clear strategy of where we should go, and we have the actual collaboration systems and agoras to have those exchanges among member states and with the Commission. For example, eHealth Network is clearly one of those. So what we do is that we coordinate the technical work among member states when it comes to data sharing for cross-border exchange, and we have technical groups with technical national experts working with the Commission to make sure that what was until now voluntary access to this collective platform becomes tomorrow a mandatory one and something that it is a collective European asset for data sharing. And there is something that's pretty close to that when it's come to secondary use of data, which is maybe a little bit newer, meaning that the cooperation of practices, the community of practice that was built around secondary use has now 2 or 3 years, I think, Fulvia. And so they are working among the same questions. How do we make sure that we have the proper governance for sharing experience with member states, but also with the Commission to build tomorrow's infrastructure for data sharing among member states and at the level of the European Union. So your question is actually super relevant now, because we have those questions with Fulvia, with other member states, for the transition among from the governance that we have now to tomorrow's governance in the context of EHDS, and how we make sure that we don't build silos from primary to secondary use, because just as you said, in the healthcare organization, more and more people working on primary use and secondary use are the same, and we need to do so also at the policy makers level to make sure that we have the idea of when data is actually created for care, we need to think how we design it to be reusable on an easy basis, and also in a manner that is relevant in the context of EHDS. So this is something that I'm pretty confident about, because we have the proper collaboration ecosystems already live, and we just need to make it, let's say, compliant with the regulation and what's upcoming in the implementing acts that will be also published for public consultation. So you will all have pretty soon access to what we have been working on with Fulvia.
Thank you, Helen. On this regard, I can also perhaps ask Fulvia for you to outline the EU-level governance model, including some common frameworks or mechanisms that can support the member states in this journey.
Yes, I mean, I'm very happy to hear from Ella that we are confident, because we are confident as well that the governance is very cooperative. We have a very good cooperation with the ministry, with the authorities, digital health authorities around the table. And I think it is a transition from the current voluntary system, both for primary and secondary, and the future HDS governance will be smooth and well prepared. Of course, we need to keep in mind that the structure of the European health data space remains a federated approach, meaning that there will be national authorities, both for primary and secondary use, responsible at the level of member states. So that is also very important. There will be authorities that will remain, let's say, the key actor into the implementation of the European health data space and into actually the daily, functioning of the system. It is important also to mention that there will be dedicated authorities, for instance, for taking, again, national authorities in charge of the market surveillance activities, because we do also, and sometimes we forget about it, but actually in the European health data space is supported by a very ambitious project of the facilitating the internal market for the EHR systems and for the services that will build build upon the availability of health data. And this is somewhere, it's an area where we expect very much cooperation from the HRC, from the industry side and the vendors that are also around the table today. A last word about the cooperation with the researchers, innovator. You mentioned the cancer community, of which we also have the genomics, very active, and many others which have been very active in the last years to come up with very important standard data, let's call it quality standards for those data for research. And we see them really playing a role in pushing this work on data quality through the HDS. It's also for the researcher a bit of a paradigm shift, because they are used to think about the use of data which have been somehow collected for research, so have a very high level of quality, they are cured, they are systematized in registries. So, and now they are facing another opportunity which is going maybe broader, with a bigger amount of data, not maybe at the same level of quality, but with a much more unbiased, enormous basis. So this also requires a very close cooperation with the research communities and all these projects that have been really pioneering in the area.
Thank you, Fulvia. Thank you very much. Carola, also in this regard, perhaps you can also share with us some governance lessons from large EU pilots that you work on this project, perhaps models that enable coordination across countries and data holders.
Yes, the first lesson, I totally agree on what Hela and Fulvia said. There are already very good exchange for primary and secondary use, like the Health Data Access Body Community of Practice, where most members are very, very active in exchanging different ways to govern this. So that's something that is very promising. Also from an ongoing project I'm involved right now, the Candle project, where we are helping member states to set up national cancer data nodes. What is important to many actors is not to replicate structures or not to create new structures if you have the opportunity to take advantage on existing ones. In the case of national cancer data nodes, there are, for example, emerging data nodes that will be tied to a national node of a research infrastructure. There are some which will likely be mandated by ministries, like ministries of health. There are others which will be tied to a research organization. So a first good step would be to take stock of emerging governance models and see what other member states can learn from, pretty much what as they are doing already in the community of practice for the health data access bodies.
Thank you, Carola. And also from Yannis, from your side, you can also perhaps share with us from the implementer view on how these governance rules can translate into hospitals or regions or even countries, procurement and compliance.
Yeah. In short, so I can just tell you what should be the roadmap of each of the hospitals. So it's divided in three stages. First stage is let's say the foundation stage, where the hospital should divide or take a third party that is owning the data of the patients, so not the clinicians and not the IT department. Second, set up the pseudonymization on the hospital level. Third one, as we heard from the previous panel, we should inventorize all the data sources and data repositories, because if you don't know where you have the data, then you also cannot manage it. Then you go to the second stage, which is building the warehouse, which meaning that you are bringing together the, let's say, data exchange, data availability platform that would separate the data from the applications, and that should be based on open standards, FHIR or open EHR. Then you should be implementing the zero trust policy, which means that the administrators in the IT teams and vendors should have somehow limited the access to the data itself, so that some worserum attacks could not happen, and so on. And then coming to the innovation and federation part, when the hospital is set, then it's open to open itself towards the ecosystem partners, meaning region, country, and other stakeholders like GPs, social care, and so on. So that then you build the consent and federation to enable that data. So when going towards the procurement, I think that, I think that different countries in Europe have different realities regarding data sharing, and that one comes through the procurement itself. We notice, for example, big American vendors that apply completely different approach in selling their openness or closeness of their business model in one country or another. No? So for sure it's in the DNA of the vendor that maybe goes towards a more closed the business model and so data sharing model. But if the country, if the regions, if the hospitals are persistent and makes those vendors to play an ecosystem proactive role, they can achieve it, because also they will always follow the money and their roadmaps as well. No? The second thing which is important in this, it's also setting clear priorities in terms of which clinical specialties, which clinical data sets are going to, let's say, be the prioritized to be shared. So is it cancer, is it cardiac, vascular, palliative? Because in this way, these big vendors can apply those data sharing principles towards their roadmaps. Just a bit of a direction on how to practically steer these things.
Thank you, Hannes. And then finally, Christian, perhaps you can share with us how these governance models, they impact industry participation, innovation uptake, and long-term collaboration models.
The IDERA public-private partnership that is funded through the EU, where through the Innovative Health Initiative, where 30 partners from 10 countries, and Spain plays a very important role here, have come together with the request to build a pan-European health data infrastructure to access heterogeneous health data from hospitals, from patients, etc. What we've been doing, and I've always compared a little bit to teams, we've developed an infrastructure that the two data requester and data holder can connect with each other, similar like we do it in Teams. We also have identified data models that can be used in order to drive the algorithms. On the one hand, the DICOM for imaging and the OMOP for the electronic health records, which is the data model which is now also used by the EMA for real-world data. However, what we found from a governance perspective, there's a significant difference, and Pilar, you mentioned it about future-proof and making it future ready for the future. Finland is definitely a North Star, and I've been working with my Health Economic Times a lot with Finland because it's fantastic to do real-world evidence, it's very clear process, excellent data, but you can only do federated accessing once. We are now trying to drive algorithm development for lung cancer identification in a federated way. That means you have to go there hundreds, if not thousands of times to go back to the data with the different iterations of the model that is going from one data provider to the next one. This is not possible at the current stage within the Finnish governance model because you would need a new application every time. So what we are doing in this instance, we are working with the Spanish data providers where we can drive this development because that is possible from a governance perspective, and now use Finland to then do it from a validation perspective. And I think these are aspects that are new, that Finland couldn't know at that time because that kind of technology didn't exist. So I think governance is also a constantly evolving area. And there are opportunities, and again, the public-private partnerships, I think it was mentioned in the previous discussion around our fantastic opportunity to work together to address problems that didn't exist yesterday, that we're working on today, and something new will come up tomorrow. And I mean, IDERA, as an example, was created 2.5 years ago. At that time, ChatGPT didn't even exist. So I think, similar like us sitting here together, it's all about collaborating and taking the future together forward, where I think we have great opportunities. And thank you again for the invitation.
Thank you very much, Christian. Okay, I'm mindful of the time here. Do I have time to ask a question from the audience? And I'm looking at my colleagues, if I do have or not. One? Okay. From the audience then, do we have one question for our speakers today? No? Okay. So I think I can wrap up in a couple of seconds. I heard the word trust a lot from you today. I think we need to work together to, well, not create, but perhaps create awareness of the value that the HDS is bringing and to communicate that to our stakeholders in our different positions that, well, we all have in our jobs with moving forward the HDS. So I would like you to thank you again one more time for coming and speaking on our plenary today. So thank you very much, and hope we can move forward with these different challenges that we've discussed today. Thank you very much. So we can take, okay.
Thank you all for these valuable insights. They've shown us that sharing data in a responsible way is not just a technical challenge, it's a matter of shared European values. We'll now take a short break before our final plenary, so please use this short moment to network, connect with your colleagues. It's the perfect opportunity to exchange ideas, take photos, and keep the energy flowing before we dive into our final discussion, focus on Europe health workforce and the skills needed for a digital future. Don't forget our official hashtag for your social media, EDHS25. We'll be back in 30 minutes. Thank you very much.